Antonio Webb, I'm an orthopedic chief resident here in San Antonio, Texas. Going to my 5th year, starting in 6 days from starting my 5th year. So as an orthopedic surgery resident, we do certain rotations. One of them is trauma surgery, is our busier rotation. That's the rotation that I'm on now. And I'm on call every 3 days. So today is Saturday, so I don't get off. I came in this morning around 5:30. I don't get off until tomorrow afternoon. So more responsibility, because as an intern, basically you go see a patient, you may not know what to do exactly, so you run it by your upper levels. The patient may need to go to surgery, or maybe treatment pass or a splint. There's indications that we tell us whether the patient needs surgery or not. And then that's your job. You manage to keep all the patients on the floor. You update our lists, put the orders in for patients. As a upper level, I operate, and I go to clinic some days, but mostly I operate. And then I kind of manage everything else that's in the hospital. So right now, from an orthopedic standpoint, there's 3 people on the orthopedic team here in the hospital. And I have to make sure everything's kind of ran nice and smooth. As an upper level, as a junior, you do have upper levels that are walking you through the case or walking you through certain things that they're uncomfortable with. But as a senior resident, I'm expected to know how to do the surgery. I'm expected to make sure everything runs smoothly, the labs are taken care of, they need blood products. So I'm responsible for that. And that's kind of a general structure in orthopedic residency. We usually do rotations. They're 2 months long. We do shoulder and elbow, we do hand surgery, we do foot and ankle, sports medicine, spine surgery, trauma surgery, plastic surgery that I'm interning here. So that's how the structure of orthopedic surgery is. It's kind of organized. But trauma, it can get very busy. It can change at any minute. Someone can come in downstairs with a gunshot wound to their leg, to their arm, and I'll have to reorganize the schedule of cases that I want to do next. So right now I'm just trying to figure out which patient needs to go to the operating room next, who's most urgent. And that's a lot of responsibility on chief resident, because you're making decisions that can potentially, if you make the wrong decision, so the patient can be potentially hurt by that. So we're about to go see a patient who has potential compartment syndrome, which is a condition where blood flow doesn't get to your legs. And usually, when someone has compartment syndrome, I go into the room and they're in lots of pain. They just can't take it. They're moving around in bed because they're having so much pain. And if you press on their leg is like rock hard. So that's what compartment syndrome is. I have a gentleman who may or may not have that. I'm about to go see him. I may or may not take him to surgery today. I just need to go see him and evaluate and determine whether I'm going to take him to surgery. But that's what we're about to go see next. I chose ortho because I like working with my hands. It's more of a reconstructive type, especially. You get immediate gratification. It's very gratifying. Like I said, it's a lot of fun. It's very collegial, especially everyone is very close to each other, and patients get good results. So that's what I like with orthopedics. Talk to the anesthesiologist and see where they'll let me take him, since he just ate. Usually, you want to wait like 8 hours because he'll aspirate and go into his lungs. If he's ate a whole breakfast 4 hours ago, they may say, hey, no, you can't take this guy to surgery. But I'm going to present it to him like it's emergent. We'll see what they say. Hey Pam, I'm sorry, we have a switch up in plans. I just talked to Dr. Hogue. I decided to bring the gentleman up with a compartment syndrome on his leg, so I'm going to do a fasciotomy. In surgery, you have to, essentially as a physician, you have to be able to make decisions. And sometimes you have to make them on the spot. So I was faced with whether I should bring this patient to surgery or not. But I think the best thing to do is bring this patient to surgery, and then I'll make an incision on the outside of his leg, see if his muscles are viable or not. And if they're not viable, that lets me know that there's an injury that was missed, or an injury to his legs that maybe we just have to watch. So, but it's called a fasciotomy. The fascia on the outside of the muscle, I'll go ahead and release it on the outside of his leg there. Don't have to worry about, there's a nerve that runs right up here called the superficial perineal nerve. Just have to watch out for it. Yeah. Compartment syndrome, a fasciotomy, which means releasing the fascia overlying the muscle. Compartment syndrome is an emergent procedure for us in orthopedics. So we like to do these sooner than later, more in the acute phase, because muscle viability is an issue usually within 6 to 8 hours. Anything after that, the muscle is probably not good. So we're going to open his compartments on the anterior and lateral portion of his leg, and then hopefully that will allow him to get more blood flow to his leg. So surgery is very methodical. It's very it's stepwise. You have to know first. You have to know the pathology. You have to be able to recognize the pathology. Next, you need to determine whether that patient needs surgery or not. And if that patient needs surgery, you need to know your anatomy. So replaying the steps in my head, making sure everything's in place, making sure you operate on the right extremity, the patient has antibiotics, they're positioned well, all their areas are padded well so you don't get bony necrosis or anything while you're operating. So a lot of different things can go wrong in surgery. You just have to make sure that everything's stepwise and you have a checklist in your head as you're going into the case. So once you get into the operating room, that's why I like surgery, because you just forget about everything else that's going on outside. I can be in a case, if I'm having fun, I can be in a case for 6-7 hours and it may feel like 2 hours to me because you're having so much fun. So it's one of those things where you just almost forget about things that are going on outside because you're so engulfed in what's going on with it. So I'm about to operate. My next case is a lady who has a hip fracture. She broke her hip. So we're going to do a partial hip replacement. It's called a hemiarthroplasty. This is our surgical table here. These are basically the instruments that we will use. This is a saw here and some other instruments that we'll use. So I'm going to have her lay on her side, do the hip replacement. It's got an anterior lateral approach. Make an incision in the side of the hip here. Go in and cut out the part of the bone that's broken, and then put an artificial hip in. So that's the next case.
Yes.
Once your shift is over, or once you're done with surgery, there's really no set schedule in surgery. It can be, you can have a day that's 4 hours, 5 hours. On trauma, the hours are a little bit longer, or you can have a longer day. So, but once the day is over and everything's kind of wrapped up, you still have to go home and study as a resident. So in residency, you still have exams, and I didn't really realize that. I thought med school, once you're done with med school, you don't have any exams anymore, but we have a yearly exam. When you get off of work, even though you may work a lot of hours per week, you still have to study and you still have to put time to do research. You still have meetings to go to. You still have other things that requirements that are expected of you as a resident. So it's not that once you get done with your shift or get done with your work, you can go home and just relax, because there's a lot of other things you need to do. You need to read, you need to prepare for cases the next day. There's surgeries that you need to know how to do. So you have to go home and put in the time. So, but I still try to get a workout in maybe 2 to 3 times per week, and I still try to have a social life, but it all comes down to work-life balance and just trying to figure out what's important to you. You got to make a lot of sacrifices, but figure out what's important to you and what's not important, so you can just cut it out of your life. So you have to have a good support system, and like I said, work-life balance is really critical, and that's something that you tend to learn how to develop over as the years go on. So orthopedics, I would say find a mentor that's someone who's been through it. Especially, I was always told to find someone kind of who maybe is a couple years ahead of you, maybe in college. If you're in college, maybe in med school, and then find someone who's as a resident, and then find a mentor who is kind of down the line, 10 years out of residency training. It's good to find several mentors, in a way they can give you different perspectives. Your step 1 is the most important. Your step 1 score, you take that after your second year of med school, to the exam that you take, and then your letters of recommendation, and also your clinical grade, so your acting internships. So as a 4th year medical student, you rotate in different specialties, different hospitals that you want to, what specialty you want to go into. So those are critical, those rotations. And you have to show up on time, you have to be a hard worker, you have to be a team player, you have to show some interest in orthopedics by doing research or some type of showing your commitment to orthopedics. So orthopedics is very competitive to get into, but it's not impossible. And for those who may not have the best score, the way to kind of take up for that is to rotate the program and just work your butt off. You got to be there on time. You got to basically outwork everyone else that's there. So to show the program that despite my score, you guys should take me, because I don't want anything else. And if you have that mentality and you get that work ethic, while you're going through rotation, you will definitely probably get a lot of programs, looking to have you come to their program. So.